Good afternoon, everyone. Thank you for joining us. I'm joined today by Dr. Dave Ceasar, our Deputy Chief Medical Officer, who will assist me later on in taking questions from journalists. But let me start, as usual, with today's statistics. The total number of positive cases reported yesterday was 1,264, which is 6.7% of the total number of tests, and the total number of confirmed cases now is 84,523. 420 of the new cases were in Greater Glasgow and Clyde, 312 in Lanarkshire and 141 in Lothian. The remaining cases were across the other 8 mainland health boards. I can also confirm that 1,241 people are currently in hospital, a decrease of 9 from yesterday, and 88 people are in intensive care, which is 7 fewer than yesterday. Finally, though, I regret to report that 54 deaths have been registered in the past 24 hours of patients who first tested positive over the past 28 days, and that takes the total number of deaths under this measurement to 3,377. National Records of Scotland has also just published its weekly update, which, as you know, in addition to cases where COVID was confirmed through a test, it records cases where it is a suspected or contributory cause of death. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID under that wider definition had unfortunately passed 5,000. By Sunday, it was 5,135. 278 of those deaths were registered last week. That's 71 more than in the week before. 198 of last week's deaths occurred in hospital, 72 in care homes and 8 at home or in another non-institutional setting. Obviously, each and every one of those deaths represents a unique individual whose loss will be causing grief and heartbreak. And once again, I want to convey my deepest condolences to all of those who've lost a loved one during the pandemic. The figures I've just reported are obviously really grim and distressing. Sometime in the future, when we are through this pandemic, we will want to consider how, as a country, we commemorate the lives that the virus has taken. That is, though, for another day. But given that, with all the positive news about vaccines, and we're hearing more positive news today about the Pfizer vaccine, given all that means that we may be starting to see the end point appear on the horizon, one of the things we should be focused on now, in my view, and all try to play our part in, is how we get to the end of this with as few additional lost lives as possible. And that encapsulates one of the motivations for yesterday's confirmation that 11 local authority areas in the central part of Scotland will move from level 4 into level 4 from 6 p.m. on Friday. The measures that come with that are tough. I'm not going to sugarcoat that. They include the closure of all non-essential indoor retail, of hospitality except for takeaway, and of premises like hairdressers, indoor gyms and entertainment venues. So these are really difficult measures. They are, of course, temporary. They will be in place until Friday, the 11th of December. But more importantly, they are, in our judgment, necessary. We must get the current high levels, albeit stable high levels, but nevertheless high levels of COVID that we are currently seeing in West and Central Scotland. We must get them coming down for 3 basic, but obviously interlinked and related reasons. Firstly, and most importantly, that is to reduce deaths and serious illness. And second, it is to ensure that hospitals and intensive care units can cope and that they can be there over the winter period to treat people with COVID and people who present with other illnesses as well. And thirdly, it is to allow the prospect of people being able to meet up over the Christmas period without that then leading to much more illness and loss of life as we go into next year. On that last point, we are all desperate for some normality at Christmas, and I absolutely include myself in that. And the Scottish Government right now is working very closely and well with the other UK nations to try to agree a way for that to happen. We want to have the same position across the UK, given family patterns that exist. But we know that people coming together when a virus is circulating will increase the risks of it spreading. And that means we need to be careful, but, and this is the key point, it also means that one of the most important things we need to do between now and then in order to minimise that risk is reduce the number of people in the population who have COVID and who will have COVID when we get to Christmas. Because if we do that, we reduce the number of people who might then be at risk of passing it on to their loved ones if they're getting together for Christmas. So that is what these restrictions are in part trying to do. Even so, they were not taken lightly, and I know that they are really hard for people, but I hope they will help us to achieve all of those aims and, of course, take us closer to the end of all of this, which we are now seeing over the horizon, as safely as possible. Now, there are three issues relating to yesterday's announcements that I want to highlight in particular today as briefly as I can. The first relates to schools. As you know, for the sake of the education and broader well-being of young people, we intend that schools stay open in level 4 areas. But we know and recognise that some people, parents, teachers, young people themselves have concerns about this. So some information being published today will be of interest. Public Health Scotland has just published some statistics about levels of COVID amongst school children. They suggest that in the first 9 weeks of term after schools returned in August, out of 700,000 pupils in our schools, there were 1,600 positive cases. To put that in context, that represents just over 0.2% of pupils over that period. And it's consistent with other evidence that COVID is responsible for a small proportion of absences from school. In addition, fewer than 1/4 of all schools in Scotland had any cases of COVID among pupils, and half of those had just one single case in the whole period. There were, as you might expect, more cases in secondary schools than there were in primary schools, but even so, fewer than half of secondary schools had any cases of COVID, and 78% of schools overall had no cases at all. And of course, where there were cases, that does not necessarily mean that COVID is transmitting in schools. The small percentage of pupils who tested positive supports other research showing that COVID cases in schools tend to come from the community, not from schools themselves. There is, of course, and we're not seeking to deny this, there is still some risk of transmission in schools. Of course there is. That's why we must continue to take all necessary steps to mitigate that. But today's figures illustrate again, I think, how well councils, teachers, other school staff and students have worked to mitigate that risk. And while we will continue to listen carefully to all concerns, these findings do reinforce our view that at this time, the benefits young people gain from being in school outweigh the overall impact of schools on transmission rates. The second issue I want to cover briefly relates to people who were advised to shield and who are living in an area which will move into level 4 on Friday. If you belong to that group, you will shortly get a letter from the Chief Medical Officer with detailed advice and guidance, and you can find information also on the Scottish Government website. One point I want to stress is that we do not expect you to stay at home for 24 hours a day, as was the case at the start of the pandemic. Although, of course, everyone in level 4 areas has been encouraged to stay at home and reduce contacts as much as possible. But if you are going out for, say, essential shopping, we recommend that you take extra care, for example, perhaps by shopping at a quieter time of the day. I know some of you will also be worrying about work. Like the rest of the population, you should work from home if you can. Employers should help you to do that. But if your job means you can't work from home, some of you will still be able to go to work, even if you live in a level 4 area, but you will want to be assured that your workplace is safe, and employers should listen to your concerns. They should already have taken significant steps to make the workplace safe, but if you think further changes are needed, then discuss these with your employers. And the letter from the Chief Medical Officer contains some additional guidance on this, which I hope you will find helpful. And if your workplace cannot be made sufficiently safe, the Chief Medical Officer's letter can be used as a footnote, as evidence that you are not able to go into work for as long as your area remains in level 4. So look out for that letter in the next few days and check the Scottish Government website if you can. We hope that providing you with the information you need, we can help you take the decisions which best protect your health and your welfare. Now, the final point I want to cover today relates to travel restrictions. And again, let me be very candid. I absolutely understand that. But we can only keep relatively low levels of restrictions in areas with low levels of the virus if we ensure that people don't travel to these areas from other parts of Scotland with high levels of the virus. Of course, more generally, the less travelling we do, the fewer interactions we are likely to have. And for areas with high prevalence, reducing interactions is one of the key purposes of these restrictions. So if you live in a level 3 or from Friday a level 4 area, you shouldn't leave your own local authority area except for essential purposes. The list of essential purposes will be published, and you will be able to find that on the website, but it includes, for example, work that you can't do at home or caring responsibilities. If you live in a level 1 or 2 area, do not travel into a level 3 or 4 area, again, except for essential purposes, and there should be no non-essential travel between Scotland and other parts of the UK. And from the start, and from Friday onwards, this guidance will become law. And that really does reflect the importance we attach to this. So please make sure you stick to the rules on travel, because by doing that, you limit your risk of getting or passing on the virus. But it's by doing that that you also make it possible for us to continue with a targeted approach and avoid having to put the whole country into the highest level of restrictions. Can I also make a particular request to students here? I'm very well aware that university and college students have had a term like no other so far, and it's been not easy at all. And if you live in an area that is moving into level 4, I can understand that some of you might be tempted to return home immediately. I'm asking you not to do that. For the moment, please stay in your current accommodation. You will get the chance to return home for Christmas, but by waiting a little bit longer, we can ensure you that you get the offer of testing for COVID before you do that. And that's obviously one way of making your return as safe as possible. Those are the key issues I wanted to cover for you today. But the final point I want to stress, as always, is that the best way for all of us to reduce levels of the virus more quickly is to stick to the rules and guidance in our own area. If you're in any doubt at all about what the rules are in your area, you can use the postcode checker on our website. But in summary, nobody outside of Orkney, Shetland and the Western Isles should be visiting each other's homes at the moment, except for very specific purposes like childcare or caring. If you do meet people from other households outdoors or in cafes, for example, the limit is a maximum of 6 people from 2 households. From tomorrow, the level 1 areas have a slightly higher limit outdoors, but for the majority of the country, remember, even outdoors, 6 people from 2 households is the limit. Don't car share if possible, work from home as you can, download the Protect Scotland app. And finally, remember facts. These are the basic things all of us can do to try to limit transmission. I know the vast majority of people are trying hard to do these things all of the time. If you're not, please do. All of us slip up sometimes, but just remind yourself every day of how important these things are. They do make a big difference. So remember face coverings, avoid crowded places, clean your hands and hard surfaces, keep a 2-metre distance from people in other households, and self-isolate and get tested if you have any symptoms of COVID. These rules will help all of us to keep ourselves safe, to keep people we love safe, to keep the NHS safe and able to keep us safe. And ultimately, these simple basic things will help us collectively to save lives. And this is a time to focus on that, just as we have done throughout this pandemic. So thank you all very much indeed. I'll move now straight to questions. Louise Scott from STV.
Thank you, First Minister, and I hope you can hear me okay. We're outside in Stirling. It's a bit windy and wet today. Despite that, there's still a lot of people here to do shopping, and we're seeing that across the Tier 4 areas, queues for retail areas. Is there any concern that announcing this change to Tier 4 on Friday, when we have during this crucial retail period, is going to lead to overcrowding and queues at retail areas, which is what we're trying to avoid?
Louise, it's a fair question, and you know, all of these things, so all of these decisions come down to judgments. And if we had announced yesterday that we were taking Stirling, for example, into level 4 and it was coming into effect immediately, you and others, entirely legitimately, it's not a criticism, would be on here today asking about the lack of notice for businesses, how difficult, and how additionally difficult that had made things for businesses. So we're trying to get the balance right here. We're trying to give business and the economy a bit of notice. We're trying to give individuals a bit of notice, but also take the decisions that we need to take. And I suppose I come back to a central point in all of this. I'm trying with the advice from people like Dr. Ceasar, with my ministerial colleagues. We're trying to take the best decisions we can in a difficult situation for everybody. But I need people to be responsible in how they behave as well, if the decisions we are taking are going to be as effective as necessary. So I appreciate people facing 3 weeks with non-essential retail closed, might be trying to pick up a few things before that, but please do that responsibly, do that safely, make sure you are following all of the facts advice. And to businesses, I know this is horrendous at any time, I know it's horrendous at this time of year in particular, but there is I think, a fallacy sometimes, and I understand that it comes from the right place, but I often hear arguments to the effect, if we just don't take measures to control the virus, everything will be fine for businesses. Actually, the opposite would be the case, because without measures to control the virus runs out of control, and actually the damage to business and the economy would be deeper and even longer lasting. So these are all really difficult judgments, and in all of the decisions we take, we have to strike balances. And whatever balance we strike, there will be people who say we should have struck another one. That's understandable and legitimate, but we just need to try and get it as right as we possibly can. Jamie McIver from BBC.
Hello, good afternoon, First Minister. You've obviously been setting out the importance of keeping schools open, but how do you respond to the concerns of the teachers' unions who believe there should be blended learning in the parts of the country which are about to move to level 4? And with so many pupils all across Scotland having to self-isolate for a period at various points over the term, we're hearing varying accounts about the quality of provision and support that's being offered to them. Some claims that they were getting more support in some subjects than others, or more support in one area than another. How do you ensure that there is a greater degree of consistency for those pupils having to self-isolate so that nobody loses out?
So again, these are all very fair and legitimate questions. On that last point, I do think there is a responsibility on councils. As I said earlier on, I think councils are working really hard to make sure schools are as safe as possible and that young people get the education experience that they need and deserve. But if there are young people isolating and therefore not at school, having young people who may have been in contact with the virus isolating is of course allowing the majority of young people to stay at school. But it is a fair point that we then have to make sure those young people, for the 14 days of their isolation, minus weekends, are getting the educational provision that they need. And I suspect there is some legitimacy that maybe that is working better in some parts of the country than others. And I know that's something the Deputy First Minister is in ongoing discussion with people in the education sector about, and I'll make sure he's aware of the question that has been asked. In terms of the main part of your question, I'm going to ask Dr. Ceasar to say a bit more about the Public Health Scotland stats that have been published today, just in the generality of what the evidence says about transmission in schools. But how I respond to teachers' unions is, firstly, not to dismiss their concerns at all. We've got to listen and try to address concerns, and we will keep doing that right for as long as this pandemic lasts. And actually, the information that has been published today is part of that. So instead of me standing here and saying, don't worry, there's very little risk of transmission in schools, we've asked Public Health Scotland to actually look at the numbers that there have been in that first term after schools returned, from August through to October, that 9-week period. And these are the statistics that I've set out today. More than 3/4, 78% of schools had no cases of COVID at all. Of those that did, half of them had one case in that whole 9-week period. So, and out of 700,000 school pupils, 1,600 cases were positive. That's not no cases, and I'm not saying there is zero risk of transmission, but it puts it into some kind of context and perspective. And it accords with other evidence we're aware of that the risks of transmission in schools is relatively low, and that risk for now, based on the situation as we understand it right now, is outweighed by the risks to young people of having them out of school for extended periods of time. So we continue to try to hear concerns, address concerns, get evidence and data that allows us to try to assuage the concerns that people have. And that will be an ongoing process. There's also, it may already have been published, there's an evidence paper being published today that I know the Deputy First Minister will be talking about later, looking at some of the broader evidence that we're aware of around the risks in schools. But I'll ask Dave if he wants to say more.
Thank you, First Minister. So these are really important points, and really just to echo the findings of the Public Health Scotland report, which suggest really that rather than, as some concern has been raised about schools driving infections in communities, they really mirror the prevalence rates in communities. So it's an important differentiation that the statistics have revealed when we look across that 7 or 8 week period. The other thing just to note is, and we look at this often, is what is the rate of infection like in adults that are employed by schools, and they have stayed relatively stable whether the schools are open or not. So whilst there are cases of teachers and support teachers and other staff in schools getting COVID, of course, that tends to mirror the community prevalence rather than be driven by in-school transmission. Now, of course, this is not an exact science, but that is what the statistics would suggest to us from Public Health Scotland as presented today. And as the First Minister has quite rightly pointed out, we've really got to take into account the long-term, if you like, magnification of effect of children missing that interaction that they have at school. So it's not just about the information that they might get at school, it's also about the interaction that they get at school, which we know has a really profound effect on the way that their brains develop and the way that they develop skills are going to be so crucial for future life. So it's a really important balance to try and strike.
Thanks. Tim Backshall from ITV Border.
Thank you, First Minister. You've advised against all non-essential travel from Scotland to other parts of the UK, and I understand that will now be legally enforceable from Friday. What's your message to people who live close to the Scotland-England border, would normally be crossing that border every day? And how will you enforce the new law if people don't comply? Could police patrols be used as a last resort?
I'll come on to enforcement in a second. On the issue of cross-border travel, in some respects, Scotland, we're all doing it slightly differently across the UK, but in some respects, Scotland is actually the last to take statutory or regulatory action here. So already it's the case, if you live in Scotland, because of the decisions the Welsh Government have taken, you're not allowed to go to Wales right now. The situation in England is slightly different, but people in England are under a legal restriction right now against leaving their own homes without an essential purpose. So by definition, they are not allowed to cross the border without an essential reason. So we're not imposing something that in some way, shape or form has already been put in place by other administrations across the UK. And what we're saying to people is, whether it is within Scotland, to or from level 3 and 4 areas, or between Scotland and other parts of the UK, and while we won't at this stage be putting this last part into law out of Scotland to other countries overseas, only do that right now if you have an essential purpose. And why is that the case? Because this is a global pandemic. Every time we travel, we risk taking the virus from one area to another. So the less we travel, and particularly if we don't need to, the more we are minimising the risk of doing that. So it's helping us keep and get the levels of infection down. And that is within Scotland right now. And this is also a factor in terms of from Scotland to other parts of the UK and vice versa. We are trying, and this is, when I say this, I'm not saying it as an implied criticism of what's happening in England at all. But England's in a full national lockdown right now. So the same restrictions are in place in every part of England, regardless of the levels of infection. We're trying to avoid that in Scotland. Now, our geography helps us with that because we've got much more of a rural part of the country in the Highlands and Islands, but we're trying to avoid having the whole of the country under the same level 4 restrictions. But, you know, it's logical. That is only possible if people don't take the virus from areas where it's highest, where I live in Glasgow, to the Highlands where it's lowest, or to East Lothian or Mid Lothian, which will be going down a level at the end of this week. So I'm afraid travel restrictions are just an essential part of what we have to do, generally to try to defeat a virus, particularly when it's a global pandemic of a virus. But within Scotland, it's essential if we are to keep that more targeted and proportionate approach. And I know it's not easy, and I know people don't like to be told you can't travel from one part of the country to another. I don't like it either, but it is vital. Otherwise, we'll have to have one-size-fits-all restrictions for the whole of the country, and you'll end up with the Highlands or Islands or areas in Lothian with lower transmission being in level 4 because of high rates in Glasgow, not because of the situation in their own area. So there's trade-offs here all the time when you're trying to deal with this virus. If you do this, you can't do that. But if you do that, you can't do this. And that's just the reality of what we're living with just now. On enforcement, the police themselves have set out that they will take the same approach to enforcement as they have done with other restrictions that we've put into regulation. For example, face coverings, that started in guidance and then we put that into regulation. I heard one of the behavioural scientists who advises the Scottish Government on the radio this morning making the point that use of face coverings went from being very low to being very high at the point they moved into law, because people respond to that change, and we hope that will happen with travel restrictions. So the police are not going to stop every car, but if they come across somebody who is flagrantly breaching, if they come across somebody who is breaching, they'll tell them and encourage them to stop. If they don't do that and they're flagrantly breaching, enforcement is an option, but it is a last resort option. We want to encourage people to do the right thing for the right reasons. Alan Smith from Bauer.
Thanks, First Minister. Just returning to the issue of schools. I know the evidence paper published today says there's no evidence of increased transmission within schools, but we are seeing large numbers of teachers having to self-isolate. Green MSP Ross Creer, who'll be leading the debate this afternoon and is calling for 2,000 additional teachers to be employed, actually believes that there's an undercounting of cases linked to schools because pupils and teachers aren't being identified as close contacts of others in schools who are testing positive, but despite not being classed as a close contact, days later they are testing positive. I was looking for a response to that, and on the point of the need to employ more teachers to keep schools safe. If a council or councils come forward and say they need more money to employ more teachers, will that be made available?
Obviously, we'll consider any request that's made from a local council. We don't, and I don't say this as a get-out card, I just say it as a statement of fact. We don't have an infinite pot of money. We have to make decisions about priorities, and we did prioritise very early on extra teachers for schools. So we have already allocated funding to enable the employment of more than 1,000 extra teachers in our schools to help with the additional pressures from COVID. So we've already acted in that regard, and we will of course continue to listen to other requests and arguments that are made. On your point about data, Dave may be able to add something. It's probably a point I would prefer to get a sort of answer from Public Health Scotland and give to you, because obviously they'll be able to set out, some of it will be set out in the report that they've published itself, but in terms of how they have counted. What I would say is that there is equally likely to be potentially an over-counting, because this report looks at the report's about school children, not about teachers, but it's reporting on any school child who has had a positive test. But that does not mean that child got COVID in the school. They could have, they might not, and I think the report makes this point, it will include children who had not been at school at any point during the infectious period. So there is also likely to be an overcounting, but I think I'd rather get a sort of technical explanation, an answer to that point, rather than seek to do it myself. I don't know if you want to add.
Thank you, First Minister. So, as you say, the Public Health Scotland report does lay out some of the caveats of the data that they have. In some instances, there will be undercounting. We know that, especially at the younger end of the school age of children, that symptoms are increasingly difficult to spot and difficult to report. So, the testing rate and the testing positivity might be altered by that. Also, that there are some issues around the transitions of children within the school years about where they are demarcated as being in that moment in time. But broadly, the evidence is very reassuring. And the point about isolation is really important, which is that it is highly disruptive to those individuals. And of course, all of the data that we discuss on this platform are at population level. That doesn't mean that at an individual level they are not highly disruptive and also very personally felt in a variety of different ways. But broadly, the population level data tells us that the infection rate in schools is mirroring the prevalence in communities, that the rate amongst staff is not so different to that in similar adults across their communities. These are all pretty reassuring and I think are positive for this moment in time. And given the effects of the vast majority of children being able to access the school environment, again, that balance feels like it is a balance of risks that is working well for children at the moment, despite the fact that there will be much disruption in the delivery of that.
That last point that Dr. Ceasar's made there is one that I find, and I know it's difficult for individuals who are isolating, but is one that I find quite persuasive in this. There are, of the around 29,000 absences, remember, out of 700,000 pupils that are being recorded right now for COVID reasons, a very, very small number are children who actually have COVID. The majority of those are children who are isolating because they may have been a close contact, and that is disruptive for those young people. And the earlier point about the need to make sure their educational experience is as good as they have a right to expect it to be during that isolation is an important one. But the alternative to that is, if we close schools and move to blended learning overall, is that it's not a relatively small proportion of young people that are having to learn in that way and be away from school. It's all young people. So in having those who may have been exposed to the virus isolating, difficult for them, I absolutely understand that, but it's allowing the majority of young people to be at school as normally as possible. And that's the balance of judgment right now, given everything we know about the damage and the harm to children of being out of school for extended periods. That is the balance of judgment we're making right now. It doesn't mean we don't listen to concerns in it. It doesn't mean that balance of judgment at some point in the future might not change, but we want to keep schools open for all of the reasons that we have very clearly set out. Phil McDonald from Global.
Thanks, First Minister. Just following up on what Louise was asking, we've spoken to some shop owners and some hairdressers in areas moving from levels 3 to 4 who are staying open later today and tomorrow to try and give people more time with them. What would your advice be to these business owners who are understandably trying to make as much money as they can before the 3-week shutdown and try to balance it with that overall public safety message? Make
sure you are absolutely abiding by all of the rules. And because if you don't, and if, you know, and I'm not talking about any particular sector or any particular retail outlet at all here, I'm just talking about in a general sense. Anytime that any of us behave in ways that are likely to increase risks of transmission, and if transmission goes up and outbreaks and clusters start, we run the risk of restrictions having to be in place longer. So it's in nobody's long-term interest. What is in all of our interests is we get the short, sharp reduction in transmission in these high prevalence areas, and then we hopefully get back to a bit more normality a bit more quickly. So, we're trying to find the right balances here in a really difficult situation for everybody. But at any point, if any of us just act out with the rules and allow the virus to potentially spread, we're not doing ourselves or anybody else any good. So absolutely make sure that you are operating safely and responsibly. Anas Hassan from Kingdom.
Good afternoon to both of you. First Minister, you've been speaking about the situation in schools. NHS 5 has just confirmed it's investigating new cases linked to 19 different schools in the region. 19. The head teacher at our community high in Glenrothes has also revealed more than 400 of these pupils are self-isolating due to cases there. Firstly, what assurances can you give parents of pupils at these schools in the Kingdom that they're still getting a good education? And secondly, how realistic is it to expect schools to be able to avoid closures as COVID-19 continues to circulate in the community?
Well, we have had relatively few closures of schools over the period since schools reopened. Not none, but in the overall context of things, relatively few. And that reflects the statistics that Public Health Scotland have published today, that actually there is a relatively low number of pupils have had COVID. As I say, 78% of all schools have had no cases at all of COVID, and of those that have, half have had just one case. So yes, there will at any given time be a number of, positive cases or contacts of positive cases that are associated in some way with a school, and that will lead to test and protect investigations, and that's part of what we are living through right now. Does that mean these schools are unsafe? No. Does it mean they have to take sensible precautions and mitigations? Yes. And part of that, if there are, I read the report about, I think Glenrothes is High this morning, where 400 are supposedly isolating. That's what I read. Then
it's not community high in Glenrothes, sorry.
Sorry, anyway, school in Fife, that having people isolating will help stop the risk of a wider outbreak occurring, and hopefully mean that school can operate as normally as possible and get back to normality as quickly as possible with minimum disruption to education overall. So yeah, again, it comes down to the balance of judgment here. We're trying to keep schools open as normally as possible because that is in the best interest of the overall body of the student population. Neil Pooran from PA.
Thanks, First Minister. If I can ask about lateral flow testing. Yesterday, you mentioned there was the potential for lateral flow testing to be opened up a bit so that it could be used without the direct supervision of the NHS. So that could mean employers could use it. What specific employers are you looking at? Which kind of companies and public sector organisations? And who do you think would be able to use it first?
The Health Secretary will make a statement to Parliament next week, which will set out a bit more detail of this. So, we haven't taken final decisions about order of priority of employers, but I don't suppose I'm sort of saying anything that would be surprising to people to say NHS staff. We already regularly test numbers of NHS staff, but we want to do that more routinely for all patient-facing NHS staff, and this will open that up. What we've been talking about a lot today, schools. Lateral flow testing could well open up the prospect of routine, regular testing for teachers and others who work in schools. Dave may want to say a bit more about this, but one of the limitations just now, we have a supply of lateral flow tests, and we hope we'll have more in the weeks to come. Right now, they're licensed only for supervised use, and as I understand it, the NHS in England is looking at using them off licence for NHS workers. But we are expecting, I think, the MHRA, the regulatory authority there, to permit them to be used unsupervised, and we're hoping that authorisation comes soon, which I then think opens up a lot more potential. But Jean Freeman, by which time hopefully we might have that clarification, will set out more next week. But Dave, do you want to say any more?
Yeah, certainly, First Minister. So thanks for that question. And again, notwithstanding the announcement next week, actually there is still an awful lot to learn from the trials that are going on in England, and we have really good dialogue with our colleagues across the four nations about what is being learnt from some of these very large scale experiments with some of these new testing modalities. They all have pros and cons. So we need to be really clear about how we deploy new testing technologies, about how we understand the test results, given that we need to make sure that we are putting in place measures to support people, whether the test is positive or negative, and to understand what to do next. And also to ensure that we're learning from different methods of deploying these. And all of that is being consolidated all the time. There is of course the outstanding issue of using these with the appropriate authority, which is why we need to wait for the independent MHRA to approve use of these things, and to ensure that we're doing that in the best way possible to support as we've talked about many bits of the infrastructure, to support as much normality of society as possible in the best way possible. So all of that is being pulled together and being rapidly developed by teams across Scotland at the moment, with advice and support from across the four nations as we speak.
Thanks, Dave. Ilsa Naismith from the Scotsman.
Thank you, First Minister. Given that one of the reasons cited for introducing level 4 restrictions was hospital capacity, we've had several reports of early vaccine success, and now plans are mentioned for mass geographic testing on the lines of what happened in Liverpool. Are there any further plans to bring the NHS Louisa Jordan into COVID-related use? And just what's your response to the claim, I think reported by the Times, that the president of the Royal College of Surgeons in Edinburgh said it was now too late and too difficult to bring the Louisa Jordan into use in any way related to COVID-19?
I've not read those comments in full, but my understanding was, I think he was talking about it being too late to use it as an emergency surgery facility, which was never the intention. The Louisa Jordan is there and capable of being brought into use for the treatment of COVID patients, should we require that, because the hospital capacity in our other hospitals has reached its limit. There are no plans, because we don't deem it necessary to do that right now, but that is there as a contingency. Of course, we are not having the Louisa Jordan just lie idle right now. It is doing other procedures, diagnostic procedures right now. I think it's done more than 4,000 of those, so it is being used and really contributing productively to the NHS.
I'll just build on that, just to respond to that. So the first thing to say is we're actually in regular conversation with our colleagues in the Royal Colleges, and I spoke with many of them yesterday, including Mike, and we talk through some of these issues, and it's really helpful to get both their feel of how things are from their membership, as well as from many other really crucial parts of the team within boards and elsewhere. And as you'll know, the makeup of hospitals in terms of hospital capacity it's not a homogeneous kind of setup. All hospitals have different priorities within it. They have different streams of patients. We have different usages across Scotland, depending on the availability of services within them. And so this is a very fluid kind of scenario. There are also lots of logistical issues about moving patients with COVID, as you can imagine, especially into a sort of non-traditional healthcare facility. As First Minister has said, we have been able to see over 4,500 patients in the Louisa Jordan since it stood up, covering 14 different specialties worth of activity. We have trained over 4,000 staff to use the facilities at the Louisa Jordan. It stands ready. It is being used. It is making great strides in actually being able to close some of the shortfall with some of the other essential services that have been difficult to do during that first wave of COVID. So it's already contributing and has been contributing since the summer to NHS Scotland's general effort. But we're always mindful about how we can adapt and flex the capacity that we have, depending on the prevalence within different settings, depending on the time of year, depending on the seasonal variation of what's coming in through our hospitals. All of this changes on a constant basis, and our teams within boards are absolutely engaged in working with us to be able to co-produce the best solutions for the most urgent and important care as much as possible, bearing in mind that we can't do everything in the way that we could do before COVID, but that we're absolutely having that dialogue all the time.
Thanks. Michael Blackley from the Mail.
Thank you, First Minister. I'd like to ask regarding the travel restrictions. Can you give any indication on timescales on these? Is it the case that they will apply for as long as any areas are in level 3 and level 4? And what about the situation with cross-border travel as well? That's not relying on what tier any one area is in. So how long can we expect cross-border travel to be banned in Scotland?
Well, with cross-border travel, of course, it's not just down to Scotland. You'd have to ask the UK government as well how long they intend to ban it, because right now in England you can't travel across the border. From England you can't travel across the border unless for an essential reason, by dint of the regulations the UK government have put in place. Now, they've done it differently in England. So in England, we are restricting people to being within their own local authority. In Scotland, in England, the restriction during the national lockdown is that you're not allowed to leave your own home without essential reasons. So therefore, by definition, you can't travel across the border. So in terms of our view, we'll have these. I've not brought my COVID crystal ball with me today because I don't have one, unfortunately. We will keep restrictions like this in place as long as we deem it necessary, and not for a second longer than that. So while we have areas in level 4, I think in order to support other parts of the country not having to go into level 4, we need to have travel restrictions. And in order to leave people in no doubt how important that is, I think it's right that they are given legal underpinning. It maybe if we have a situation, which I hope we will have soon, where we don't have areas in level 4, we will consider at that point whether they are necessary at all, and that will depend on levels of the virus, and if we think they're still necessary, whether they are still necessary to be in law or whether we can go back to guidance. These things will be kept under ongoing review. I can't say with certainty when we will end these, because we have to take these decisions based on all of the best evidence and judgment. But generally, and in particular with travel restrictions, we won't keep them in place a minute longer than we feel they need to be in place, because I don't want to have a situation for any longer than necessary we were restricting people's ability to move around the country. But while they are necessary, and they are a vital part of what we're trying to achieve. Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask for your reaction, please, to reports of a possible 5-day relaxation of household mixing rules over Christmas. I've been speaking to Stephen Riker from St Andrews University this morning, and he believes a sort of informal contract with the public where more mixing is allowed, but with a greater focus on hygiene and safety in the home. He believes that could increase compliance and ultimately reduce contact. I appreciate discussions are still ongoing with the 4 nations, but what is your reaction to those reports, please? And do you believe there's a case for relaxing the rules to maintain compliance over Christmas and early next year?
So, firstly, no decisions have been finally taken yet, so I'm going to talk in general rather than in specific. There are 4 nations discussions ongoing. I think there were discussions at official level this morning. There'll be a 4 nations discussion that I take part in with Michael Gove and the other First Ministers later today, where, amongst other things, I'm sure this is something we will talk about. So, in general terms, yes, I do think at Christmas it is important that rather than leave people with restrictions that are so tight that many people will try to get round in order to see loved ones at Christmas, it is better to do what we've tried to do all along and treat people like grown-ups and say, OK, here is perhaps a bit of leeway that, as long as we all behave responsibly within, allows us to have some time with loved ones at Christmas. Now, what the parameters are around that, what the numbers around that are, there are no decisions, but we do want to allow people, and it will be within limits, undoubtedly, to see people that right now they're not able to see because of the very strict ban on household mixing. So that's what we're trying to come to a sensible position on right now. And I do think I'm a great believer, knowing, and it's from experience of knowing how well people generally have complied with these restrictions over the past 8 months, that if we say to people, you can do this, but it's really important that you don't do this, then the vast majority of people will try to stick within that. The final point I would make here, I'll maybe bring Dave in as well to make this point from a clinical perspective. We know that when a virus is circulating, the way to stop it spreading is to stop people coming together. That's why we are saying to people, don't go into each other's houses right now. So if at Christmas, for good and understandable reasons, we say, OK, it's fine to come together a bit more, we know that that will lead to the chances of the virus spreading more. So we've got to mitigate those risks as well. And part of that will be trying to put safe limits around that, giving people good advice about what to do. But a key part of that right now, which comes back to one of the reasons for yesterday's announcements, is that the lower we can get infection levels now, the fewer people going into Christmas will have this virus. So the lower your chance will be that one of your relatives coming to your house for Christmas Day maybe will have it and pass it on. So that's why we need to get these levels of infection as low as possible right now, because that then doesn't extinguish the risk, but it lowers the risk, which is one of the motivations that we should all bear in mind when we're going, those of us who will be living in level 4 areas, as we go through the next 3 weeks. Dave, do you want to put that into proper clinical language?
So thank you, First Minister. I was really just going to remind folk, not that you really need reminding, that the virus only has two aims in life. It's to survive and to make more of itself. And the way it does that is by being transmitted between people. And we know this, we've known this for 9 months, and it doesn't take a day off. So all of the wrappings that we put around the restrictions and things are to make it bearable for us, which I totally understand from a humane perspective is really critical. But ultimately, the virus only wants to survive and make more of itself. And we are the opportunity for it. So we really have to get that into our habits of daily life to enable ourselves to be able to suppress it as much as possible, to make sure that we're understanding that the implications of what might come at Christmas time and at any other time of the year, to enable that to be as least likely for the virus to be able to succeed as much as possible. It's as simple as that.
I want people to have the ability to see loved ones at Christmas. I want to see loved ones at Christmas, and we're determined to try to make that possible. As I said yesterday, it's not the only reason, but it's one of the reasons for taking these decisions now. But I equally, and everybody in a position like mine will feel the same about this, I want to do that, if possible, in a way that also minimises the risk of me standing at this podium in late January reporting really horrible numbers of people who have died because of infections that they've picked up over the Christmas period. So, like so much with this virus, we're trying to strike the right balances, but we all understand from our personal feelings as well as more generally the importance for people of Christmas, and that is a key consideration of all of us right now. Dan Vevers from The Sun.
Good afternoon, First Minister. Glasgow has had 277 cases per 100,000 people in the 7 days up to Friday, compared to a national average of 140. That's quite a substantial gap you have to try and close over the next few weeks. And you've said the level 4 restrictions end on December the 11th, but if you don't get COVID levels down far enough in high prevalence areas by then, could we be looking at new or renewed level 4 measures in those places next month? And just quickly on the travel restrictions, can you just confirm that the regulations will match the current guidance that allows people in level 3 or 4 areas to go to other council areas for outdoor exercise, like a walk in the country, cycling, running or golf?
Yes, they will. Obviously, the regulations will express that probably in more legalistic language than guidance is expressed for obvious reasons. But yes, so you will be able to go a short distance outside your local authority area if that's the only place you can go to for exercise. And similarly, if you need to do that for essential shopping, if it's not practical within your local authority area to do your essential shopping within it, you'll be able to travel a short distance to do that. So we're trying to be sensible about this, make reasonable exemptions for people, but not undermine the overall objective here, which is to stop taking the virus from high prevalence areas to low prevalence areas, which then puts them at risk of having to go into higher levels of restriction. On the first point here, the level 4 restrictions that were announced yesterday will end on the 11th of December. I'm being very clear about that. Given what we know about the life cycle of this virus, we may not fully know from our data what the full effect of the restrictions have been, but we will lift the level 4 restrictions. That will not mean, of course, a return to complete normality for these areas. We will then decide what level each of them should go into. One of the things we hope, if you look at the data in Glasgow over the last few weeks, it's been relatively stable. The restrictions that have been in place have stopped it going through the roof, which is good, and we shouldn't lose sight of how important that is. But looking at they're not coming down fast enough. So you're kind of looking at a period of, is Glasgow going to be stuck in level 3 forever? What we hope is that by having a short period in level 4, we might actually make it quicker for Glasgow to get to level 2. Now, it may not come straight from level 4 to level 2. It may have to go back through level 3 for a period, but it will get to level 2 quicker than it would if it just lingers in level 3 for longer. So these are the kind of difficult judgments that we're trying to make. Of course, if you see cases in Glasgow come down, you will see the national average come down as well, because that part of Scotland is such a big part of the population density of Scotland. So it's not so much the gap, it's the overall direction of travel and the pace of reduction. And that's what we're looking to see now, not just a stable, mildly reducing, but a prevalence that starts to come down more sharply. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Just a couple of issues. On Christmas, will you envisage some sort of arrangement whereby families can mix freely in a bubble? Because obviously, if you're going around somebody's house for Christmas dinner, then the idea of maintaining social distancing for a day is fairly unlikely. And on a fairly worrying Public Health Scotland report this morning, it says that the number of people diagnosed with cancer fell by 4,000 by 21st of June this year, a reduction of 40% between March and June. Is it possible that the restrictions we saw on screening and on cancer treatment during the first lockdown caused more harm than good?
I don't think the restrictions cause more harm than good, because without those restrictions, we would be, not facing, as we are, the already grim death toll of 5,000. It would be many, many, many times that potentially. But we've always acknowledged that lockdown restrictions do other harms, which is why we have the 4 harm analysis of any restrictions that we have, and we encourage, and I want to take the opportunity. I'm going to ask Dr. Ceasar in a moment to answer the question about cancer diagnosis substantively, but anybody who is worried at all about symptoms that could be indicative of cancer, see your GP. Don't hold back from seeking advice about that. It's really important that the health service is there for you. Before I hand over to Dave on that, though, I'll just say a word about Christmas. What I want to, so yes, that's possible, but that is not the same as saying that's been decided. The idea of a bubble, or bobble is maybe a more appropriate way of articulating it at Christmas. These are the kind of things that we're discussing and trying to come to a sensible view on. But what I want to do, beyond talking in generalities, when I give the detail of Christmas is so important to people that I want to stand up here when a decision is taken and give people clear advice rather than get too far into it might be this, it might be that. So I don't mind speculating on some of the generalities, but I think people want to hear not what might be possible, people want to know what is going to be possible, and that's why it's important to try to arrive at these decisions in a proper, considered and informed way, which hopefully we will do in the not too distant future. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Concerns have been raised by the Scottish Greens, among others, over what they...
Can I interrupt you a second? Because I omitted to go to Dave to answer the second part of Simon's question. So my apologies, I'll come straight back to you in a second. And it was a very important question, so sorry.
No problem. So thank you for the question. It was on cancer and the report from Public Health Scotland that 4,000 fewer cancer diagnoses had been made between January and June of this year compared to last year. So just to give that context. I think just remember where we were in February, March, April time, which was we were looking at the potential with the pictures from Spain, with the pictures from Italy, the knowledge that we had about the coronavirus at that time, that we were facing potentially a situation where our NHS systems would be overwhelmed, and that would cause a disproportionately high mortality rate across the population. Fortunately, we didn't see that, largely down to the huge efforts in repurposing large areas of our health service, so that is a success story. And with that, there is an acknowledgement that we haven't been able to do some of the things in the way that we would have liked to have done, especially around cancer and other services. The good news is that since June, we've been able to remobilise many of those services. In fact, referrals for cancer investigation and treatment are now at 110% the level that they were pre-COVID. So just again highlights the resilience of our colleagues out in the system who are adapting their ways of working to be able to try and make up that shortfall, use of other facilities, the adaptability of teams in being able to do that. And so just encourage you to say, as has been said many times before, that the NHS remains open for business. If you're worried about something, please do contact your GP or your healthcare provider to enable these things to be carried out. We recognise that there is still some anxiety about accessing healthcare services because of coronavirus, which is, of course, all that we talk about up here, but that these services for other really important healthcare needs remain open, and really encourage you to come forward with all the precautions as we talk about all the time, which are in place in all of these settings to enable treatment for other urgent conditions to be carried out.
Thanks. Alistair, sorry, I'll come back to you.
Hi, thanks very much. Concerns have been raised by the Scottish Greens, among others, over what they say is the Scottish Government's lack of planning for the safe return of students in January and the risk this presents for another COVID outbreak. So the Greens are calling for comprehensive testing for those returning, as well as preferably an overall reduction in student hall populations. I just wondered what your response was to that. And if I could just ask as well, just on Christmas, in Scotland there's obviously traditionally a big focus on Hogmanay as well as the kind of Christmas period itself. Do you kind of foresee a possibility that rules could be loosened then too? Or do you think we'll have to choose between loosening rules over either Christmas or Hogmanay?
On the first part of the question, we are thinking and discussing and planning for the return of students. Obviously, our initial focus was about the safe return of students from university home for Christmas, and we've already set out testing plans there. But in the very near future, we'll also set out our plans with universities for students coming back. And it may be that there's a range of things there, staggered returns, more of a blended learning approach for a period, and also the use of testing before students come back as well. But these plans are still being finalised. So I can't give you a definitive answer on the second part of your question, but you're right. For Scotland, perhaps slightly more so than other parts of the UK, Hogmanay and New Year is very important for some families in Scotland. That may be the time they get together, even more so than at Christmas. So we do have to take that into account in our planning and remember that we need to think across the whole festive period. And I don't know yet, because we haven't taken final decisions, what the overall limits we will try to encourage people to stick to are, but we need to recognise that there is only so much we can do without allowing the virus to really take a grip of us again. So we'll have to come to sensible judgments and balances, and it will not be, whether it's for Christmas alone, New Year alone, or across the two. None of us are going to be able to do everything that we would normally do at Christmas, because, it's just not going to be possible. What we want to do is give people the ability to do as much as is possible, but without allowing the virus to take hold and take more lives as we go into 2021. Helen Puttock from The Times.
Thank you. I know you said you don't have a crystal ball, but do you have any modelling?
Equally, I don't have the ability to hear you right now, Helen. You can maybe turn your sound up.
Is that any better?
It's a little bit better, yeah.
Turn it right up. Okay, so do you have any modelling to show what the best and worst case scenarios are likely to be in terms of case numbers by November the 11th? And should people who can't do their usual Christmas shopping trip because of travel bans and retail bans right now delay until after November the 11th? Or given all you've said today, would it be more sensible just to rule out such Christmas shopping trips this year?
I'm assuming you mean December the 11th, since November the 11th is already passed, and I'm assuming you don't mean next November the 11th, when hopefully we won't be standing here talking about this at all. We have modelling for all sorts of things, but what we're trying to do with the 3-week level 4 is get these stubbornly high levels of the virus come down. The more people comply, the more people reduce their contacts during that 3-week period, frankly, the more successful we will be. And we won't need modelling to tell us how successful. In the fullness of time, we'll have actual data about infection numbers and hospitalisations and death numbers that will tell us what the impact of that was. What I would say to people is, while non-essential retail is closed in level 4 areas, support retail as much as you can. Online click and collect services are still going to be open, so try to do as much of your shopping during that period in those safe ways. And after the 11th of December, when these restrictions are lifted, it will still be really important that people behave responsibly and safely. And so mad rushes to the shops at any point during a global pandemic is not advisable. So, it's probably doing what you can to support retail during a difficult period, just to do your shopping in different ways over that period rather than saving it all up to go to the shops. But people will want to go to the shops when they can. The most important thing then will be that all of the restrictions otherwise in place are still abided by. And lastly, today, Kenny McBride from Broadcasting Scotland.
Thank you, First Minister. Regarding the new elections legislation that you announced yesterday, just a couple of things. What is Scotland now has an expanded franchise. What is the Scottish Government doing to make sure that everyone is registered and advised on how to vote? What will the Scottish Government be doing to encourage and support expanded postal voting? And finally, there's a part in there about potentially postponing the election. I was wondering what circumstances would lead to that, and is that a decision of the executive or is that a decision for the Parliament?
I don't have the terms of the legislation in front of me right now, forgive me, so if I'm getting any of this wrong, I'll correct it later on. But we're trying, the presiding officer has a key role in decisions about postponing, which we really hope doesn't happen. And we have developed this legislation very much on a cross-party basis, and that would continue. So it would be a Parliament decision. It may be a decision if, as I hope it doesn't, but if it does arise, it may be a decision that Parliament has to take on advice or recommendation or evidence that the Scottish Government provides, but it would not be a decision purely for government. Equally, there are all sorts of, in normal times, and this will be true going up to the next election, there'll be campaigns to encourage people to register, to sign up for postal votes, to exercise their vote, but it's not. I think the Electoral Commission that tends to do these campaigns for obvious reasons. It's not individual governments or parties that do them, but these plans I'm sure will be set out in due course. That concludes the questions today, so thanks everybody for joining us. Thanks to the journalists, to Yvonne for our BSL interpretation, and today for helping me with the questions, and most importantly of all, thank you to all of you. Please continue to stick with these restrictions. I know they are really, really tough, and we're all thoroughly sick and fed up of this. But we can see the end in sight, but we'll get to the end more safely if we all continue, hard though it is to make these sacrifices. So please, unless you're in the islands, stay out of other people's houses right now, and make sure you're remembering the facts advice. And remember to check through the postcode checker what the particular rules are in your individual area, so that you know how to abide by them, and abide in particular, as well as the household restrictions, by the travel restrictions, because that is really important to stop the virus spreading from one part of the country to another. So thank you for everything that you are doing. Tomorrow I'll be in Parliament at I think 12:20 for the update there, and then a session of First Minister's questions, and I will be back here on Friday at 12:15, and of course on Friday at 6 p.m. the level 4 restrictions will come in the 11 local authority areas I spoke about yesterday, and that will be an opportunity for me to address any questions about those that people may have at that point. But in the meantime, keep safe, and please continue to stick to the rules. Thank you very much indeed.